Welcome. Good afternoon. Welcome to our press conference of the United National Congress. My name is Dr. Kirk Megu. I am the Public Relations Officer, and I am joined today by MPs Dr. Rai Ragbir from Kumuto Manzanilla and the MP for Caroni East, Dr. Rishad Sitaran. Both of them are the shadows for the Ministry of Health, and that is a topic which we will be speaking about today at this press conference. We will start off with Dr. Rishad Sitaran. Rishad.
Thank you very much, Kirk. Good afternoon, everyone. Today, I'll be responding to what could only be described as shameless political mudslinging at yesterday's Ministry of Health media briefing. The Honorable Minister, Terence Dayal Singh, chose a public platform that should be utilized for public health education of our citizens to attack my political leader, Kamla Prasad-Busesa, Senior Counsel. And I can tell you, citizens were not impressed. Constituents of Caroni East were not impressed, and the country was not impressed. Minister Dayal Singh, please leave Ministry of Health press briefings for how we as a nation may respond and manage the current COVID-19 crisis that we are currently experiencing. And please leave the politics out of the business of the Ministry of Health. Moving on, I would just like to give you a few stats of where we as a nation currently are with regards to the COVID-19 management. Thus far, 148 people have died from COVID-19 in the first 17 days of May. The 148 deaths recorded thus far have eclipsed the total death toll of 2020, which was 127. So this speaks volumes of where we are right now in our pandemic management. Currently, the surge of cases is currently on an upward trajectory, and we don't even know when the peak will be. We are in a very, very dangerous and precarious state here in Trinidad and Tobago. Currently, Trinidad and Tobago's case fatality rate for May 2021 is now at 2.34%, meaning that at least 2 persons out of every 100 cases may die of COVID-19. Just as a comparative example, for the entire pandemic, this country's case fatality ratio was 1.85%, while globally it stands at 2.7%. So what this means is that more persons are dying right now in Trinidad and Tobago than in many other places in the world. Why is this so? Why is this so? Is it because citizens cannot access care that they need when they may contract COVID-19? Is it that citizens cannot go to the hospital and access a ventilator or a bed or oxygen, as may be the case? Are some citizens having to stay at home and possibly suffer the symptoms of COVID-19 and possibly have a sudden death? These are all questions that we would like the Minister of Health to explain. Our case fatality rate is 2.3%. This far exceeds the global standard right now of 1.85%. And it speaks volumes to where our health infrastructure is currently in Trinidad and Tobago in the management of COVID-19. Our country's total COVID-19 cases now stands at 17,000, with a record high of 6,000 plus cases considered active as of today. Active cases include COVID-19 positive people isolated at home, in step-down facilities, and in hospitals around our country. Tobago, and this is a very important point, Tobago's active cases increased to a record high yesterday of almost 100 cases, with a daily high, which was also a record, of 25 cases reported in the last 24 hours. And this is very, very concerning because around the Easter period, when the Prime Minister invited all of Trinidad to go to Tobago to have a vacation, Tobago was almost COVID-free. So the question begs, where did all of these COVID cases arise in Tobago? It's obviously they came from Trinidad, asymptomatic persons that went on the plane or the boat and they traveled to Tobago, and thus infected persons there gathered, mingled, and spread the disease. It doesn't take a rocket scientist to figure that out, Prime Minister. The Prime Minister also said around the 18th of March 2021 that what is happening in Tobago at the time was by design, and he had followed the science. Prime Minister, I'm asking you today, is what is happening in Tobago 8 weeks after, is this your design? Moving on, our nation is currently in great distress. Minister Dayal Singh, all eyes are on you. Because of your incompetence, we are now entering a 3-month state of emergency. And this can only be described as a nuclear bomb to our small and medium business sector. People throughout the nation, as well as in Carinese, are hungry, and we need resources to help them. These are very, very difficult times for the poor man in Trinidad and Tobago. We currently received 100,000 Sinopharm vaccines yesterday, and the vaccine program, our vaccination program, will restart tomorrow. Minister Dayal Singh, I'm asking you to please make sure and to ensure that the vaccination program allows for the equitable distribution of vaccines to all those who may need it. We are getting reports that lists are being submitted to regional health authorities with names on them as persons that may preferentially want a vaccine. All I'm asking, Minister, is to make sure vaccines are equitably distributed among all citizens of our country according to the risk factors that a person may or may not have. Health facilities are currently overflowing. We have reports that the viral tents that are set up outside health facilities are packed to capacity. Persons are on wheelchairs asking for oxygen. Persons are lying on the floor. This is a deplorable state of conditions here in Trinidad and Tobago. We are also getting reports that many of our health infrastructure facilities are understaffed and that the workforce is currently overworked. Many persons have been asked to quarantine, and thus we have a small percentage of the workforce that are currently trying to perform all the shifts that maybe more persons would have had to do before. The question I am asking now, Minister, are tests being performed on doctors and nursing staff to ensure that they are COVID negative? We are getting reports that persons are not getting a test when they request one for fear that they may have to go into quarantine and thus lose another member of the workforce at that particular health facility. This is a cause of concern. Dr. Rai will speak more about this, as well as what is happening with our ambulance service here in Trinidad and Tobago and the issues that he is having as a medical practitioner in accessing care for some of his patients. I would like to now go to the major part of my contribution here today, where I'll be responding to some statements the minister made yesterday at the Ministry of Health's press briefing. I would like to inform Minister Dayal Singh that the UNC has never flip-flopped on vaccines, our policy. We have always said that vaccination is the only way in which we can come out of this pandemic-induced lockdown. Every single member of the opposition has stated this. I myself have been a prominent advocate for vaccine procurement since late 2020. So it is wrong to say that we have flip-flopped on this issue. We have always been on the side of vaccines. The issue we have is that we have no vaccines, and we don't have access to the better vaccines that are available globally, such as the Pfizer and the Moderna vaccines. We are seeing globally where the United States and the European Union are favoring the mRNA vaccines, which are the Pfizer vaccines and the Moderna vaccines, over the viral vector vaccines, which are the AstraZeneca and the Johnson & Johnson vaccines. So our issue, Minister Dayal Singh, was always on the type of vaccine that we would be getting here in Trinidad and Tobago, and not that we were opposed to vaccines. We just wanted the best for our citizens here in Trinidad and Tobago. We are the richest country in CARICOM, and in our opinion, we deserve the better. My leader, a statement was made yesterday, Minister, that my leader had to intervene for our country to get certain gifts or field hospitals to this nation. I would like to say, Minister, yes, my leader did intervene, with regards to the gift from India, and that was her right as the opposition minister, as the opposition leader of Trinidad and Tobago. You should listen to her more often. It was because of her vision of Trinidad and Tobago that we built the Couva Hospital, that we built the Arima Hospital, we built the Point Fortin Hospital, and we refurbished the Cora facility. Could you imagine if we did not have these 4 institutions in our national healthcare system? Where would we put all these patients that we currently have? Because of her vision, it has added hundreds of well-equipped beds into our hospital system. Currently, it's not enough, and that just speaks volumes of the state that we are in terms of our COVID management. Where would we be right now without these facilities? My leader has the greatest respect for our healthcare workers in Trinidad and Tobago, be it doctors, nurses. She actually, during her tenure as Prime Minister, created the Nursing Academy, as well as she has provided scholarships for many, many, many young, deserving students of our nation to study medicine, right? Doctors trained under the umbrella of national scholarships during her tenure, and hundreds of doctors were trained. What has your government done? What has your administration done? They have slashed the number of scholarships that are available to poor and needy families that may have a very intelligent individual among them. These persons now may not be able to do medicine. She has the greatest respect for doctors of our nation. My leader, another statement Minister Dayal Singh made is that my leader is acting desperate. Minister Dayal Singh, my leader is concerned for the lives and the livelihoods of our citizens here in Trinidad and Tobago, and perhaps you should be a little more desperate, and perhaps that would allow you to do your job a little better. My issue, Minister Dayal Singh, is that more than 1 year into this pandemic, why is it that citizens cannot get a bed and cannot have access to a ventilator or oxygen? My leader made reference to someone that presented to the hospital and was turned away, not receiving medical attention because of his age and whatnot. My question is, after more than 1 year, why have we not procured more ventilators for our country for a situation such as this? That was the first issue that happened in the United States of America, where persons were suffering from respiratory distress, and America made a drive to source ventilators from around the world, as well as to manufacture their own ventilators. Why have we not stocked up on ventilators? Is paintings, is golf courses more important than ventilators for our citizens? We are now in a very, very precarious position here in Trinidad and Tobago, where cases are continuing to rise. There's a need for more and more persons to access hospital care, and we just don't have enough equipment for it. It is my leader's right to ask questions. She is the opposition leader. This is a democratic country that we live in. It does not matter if a citizen has voted UNC or PNM. It does not matter for us. We will represent them all when they need representation. And lastly, Minister Dayal Singh, no one is trying to derail anything. We are all suffering together. I am suffering, Dr. Rai is suffering, Dr. Mego is suffering, everyone is suffering. The UNC does not see discrimination in representation. COVID-19 does not see if someone is UNC or if someone is PNM. Businesses have been closed, people have no income, and you are embarrassing your team of health professionals at the Ministry of Health by making the press briefings a political platform. These are professional people that have studied public health and have become specialists in their fields, right? Do not make the platform in which they are sitting in with you a political puppy show. They will not be working under a PNM administration forever. I will now turn to an issue that you tried to address yesterday at the press briefing. Minister Dayal Singh, yesterday you said that in the press briefing that the efficacy of the Sinopharm vaccine is not in question. When a member of the media asked you, why is it that some countries are giving 3 doses of the Sinopharm vaccine? And you went on to say that Pfizer also needs 3 doses. This is wrong, Minister, this is wrong. What Pfizer has said is that they are testing a 3rd version, a 3rd dose of their vaccine in order to supplement their first two doses in order to counteract the variants that are currently arising around the world. New variants of the virus, most particularly the South African variant, which is proving to be very, very troublesome for most vaccines around the world. In Sinopharm's case, their 2 doses in some cases are having difficulty in producing an immune response in certain populations. So it's very, very different to what Pfizer is trying to achieve. Sinopharm is, in some cases, taking 3 doses to produce an immune response against the original coronavirus. What Pfizer is trying to do is create a 3rd dose to counteract the variants. It's similar to the flu shot, where every year, you have to take your annual flu shot, and it's formulated based on whatever strains of the influenza virus that may be circulating in the global community at the time. Both Pfizer and Moderna are working to solve the problem against the South African variant. I am asking you, Minister Dialsingh, today, are we here in Trinidad and Tobago protected against the South African variant of the coronavirus? That is my question to you. I will like to move to another statement that Minister Dialsingh made yesterday, and it was regard to over-the-counter COVID-19 test kits. Minister Dialsingh said that he intends to advise for the prosecution of a pharmacy that currently sells over-the-counter COVID-19 test kits. Minister Dialsingh, how can you be so small-minded? Social commentator Lynette Joseph also said, once you can breathe easily, you do not need to spend a fortune testing for COVID-19. Some of us are gullible, and some have more money than common sense. Now, these 2 statements are very unfortunate. What it seems to be is that you are actually asking people not to get tested for COVID-19. And if we would track back to 2020, where the Ministry of Health had implemented protocols for someone to get a COVID-19 test, whereby you actually had to be symptomatic and you actually had to have certain symptoms to qualify for a COVID-19 test. And this is the root of the problem. This administration just seems to forget that many patients are asymptomatic and are COVID-19 positive, and thus they are carriers of the disease and they may spread the disease. That is exactly why they got themselves into trouble with Tobago. You allowed persons to go on a plane or a boat without a PCR test and to go to Tobago. 50,000 persons moved between the 2 islands. It was the first mass movement of persons since the pandemic started. Obviously, those persons didn't have a fever. Obviously, they didn't have a sore throat because they wouldn't have gone. They just took one person, one asymptomatic person to be there, and that would have caused the entire situation that we are now facing. I ask you, Minister of Health, and those that may be sympathetic to you and your performance as a minister, is this a means to reduce the ability of citizens to determine their COVID-19 status? With hundreds of new positive COVID-19 cases daily, and with the death tolls rising, the numbers do not paint a pretty picture for you and your administration. Given the tidal waves of mistakes that have been perpetrated on our unsuspecting public, it seems to me that it's an attempt to artificially deflate the daily tally of positive COVID-19 cases. We are a country with over 1 million syringes, but less than 5% of the population is partially vaccinated with 1 dose, and less than 1% of the population is vaccinated with 2 doses. As Senator Jayanti Lakshmi Dayal said, we have 1 million syringes, but we have no vaccines. We are in a country that has allowed the P1 variant to enter our borders, and we are unable to stem the tide of illegal immigrants. We knew since December 2020 that the P1 variant had originated in Brazil, and it was spreading like wildfire in Brazil. And it was just a matter of time before it reached Venezuela. They share a border of over 2,800 kilometers. Venezuela is overflowing with P1. It was just a matter of time before it came across here to Trinidad and Tobago, because they have easy access into our country. They also have very little medical infrastructure in Venezuela and little to no access to medication. Many persons in Venezuela would be coming across here to get medication for their family and to carry it back to Venezuela. It's basically a free-for-all on that border. It was just a matter of time before we here in Trinidad and Tobago got the P1 variant of the Brazilian coronavirus. And thirdly, we are a country where the Prime Minister asked all and sundry to visit Tobago for Easter, and then be forced to call a state of emergency 8 weeks after. Prime Minister, watch the graph that Dr. Avery Hines puts up on the media briefings. Plot when you said everyone go to Tobago, plot the Easter weekend, and then every 2 weeks, take a tally of the number of cases we have, and you will see it will correspond exactly to doubling of the number of cases. Exactly right what CMO Roshan Parasram said, Dr. Roshan Parasram. It is cause and effect. The first mass migration of persons within Trinidad and Tobago was a major, if not the contributing factor to what we are facing currently. We currently have tested over 161,000 persons, both at public and private facilities, which is just about 11% of our population. And according to international statistics, we are at the bottom of the table. From what I researched last night, only Mexico, Pakistan, Indonesia, and China have tested less people. The World Health Organization sent a clear message to all countries in March of 2020. Test, test, test. And we have not done that. So how can you say you are following the science, you are following the guidelines of the World Health Organization if you have not tested? You are being very facetious with us. The more tests that are conducted, the easier it is to track the spread of the virus and reduce its transmission. Testing is important for two reasons. It warns the individual that is being tested and allows them to protect their family and their loved ones. That person knows their status. They know if they are positive or if they are negative, if they are contagious, if they can spread the disease. And it also provides surveillance and allows us to find out what we can do from a public health perspective in order to mitigate the spread of this virus. And this is even more vital right now with the more contagious Brazilian variant that is in our population. Since the 15th of December 2020, the US Food and Drug Administration has issued emergency use authorization for over-the-counter COVID-19 tests in all major pharmacy chains in America. And these include the Illum COVID-19 home tests, the Abbott antigen self-tests, and the Pixel home collection kit. All these three tests do not require prescription. So you do not need a doctor's prescription to utilize this test, and they are intended for use in persons with or without symptoms. This option provides the citizen with access to convenient testing that can be conducted at their own home and serves to complement a nation's commitment to providing their population with access to comprehensive COVID-19 testing. Why would you not be in favor of this? It begs the question, why would you not want citizens to have a facility such as this where they can test themselves? By authorizing tests for over-the-counter and allowing it to be sold in drugstores, which are currently open during our state of emergency, a patient can buy it, run the test on themselves, and find out their result in as little as 20 minutes. It would expand citizens' access to testing and reduce the burden on both the private and the public laboratories, as well as their supplies, which are very scarce. Similar to other antigen tests, a small percentage of positive and negative test results from these tests may be false, and that is to be understood. It is not in a professional laboratory setting. Therefore, patients without symptoms, when they get a positive result, should presumably assume that it is positive until they can confirm it with another test. And that counteracts your argument, Minister, where you said that if citizens have access to these tests, they would not go to a private laboratory or the public health institution to get tested. No, these tests are just for a simple diagnostic purpose to allow a citizen to know if they may or may not be COVID-19 positive. And it is a very effective tool against COVID-19, and it's currently utilized around the world. Why isn't it that we could have that facility here? Given the long wait times in the public health system, we have patients waiting many, many days for their COVID-19 test result. At the private level, we see where cars are lined up along the street, probably 100 cars, waiting for their COVID-19 tests. The system is overburdened, it is overworked. These COVID-19 tests should be a welcome addition to our arsenal in combating this surge that we are currently experiencing. Every effort must be made to flatten this curve and to restore the health and the safety of our nation. I hereby make a call for the Minister of Health to immediately make available the importation and commercial retail for the use of FDA-authorized over-the-counter COVID-19 testing kits to allow citizens the option of not having to overburden the public and private healthcare facilities. Minister, more has to be done in terms of education of the public. As we can see, not everyone in the public is adhering to the public health regulations, as well as more must be done to get persons vaccinated. I just read that in New York State, they are currently holding a lottery system, and they're calling it New York State Vax and Scratch Lottery. And basically, once someone gets a vaccine shot, they are giving a free lottery ticket with the chance to win $5 million US. And it is certain very ingenious incentives such as this is what we currently need in Trinidad and Tobago to get more shots in arms in our citizens and allow us to reach that herd immunity that we have to reach in order to exit this very dreadful situation that we're currently experiencing. When we had no COVID cases, when we had very little COVID cases, you know, the mantra was the government did a fantastic and a great job. When we have many COVID-19 cases, it is the citizens to blame. I would like to reinforce that this government has made 3 major errors in its COVID-19 management. One, in the procurement of vaccines. They took too long to procure vaccines. For example, we were the last in CARICOM to get the gift from India. Secondly, we messed up totally with Pfizer and the Ansa Makal group. And thirdly, we had to finally go to Sinopharm. And what we did with Sinopharm is we entered into an arrangement with Sinopharm pending that vaccine getting WHO certification. And that is something that we could have done with all the other vaccines in 2020, where we could have entered into arrangements with Pfizer, Moderna, Johnson & Johnson, pending them getting WHO certification. And thus we would have those higher quality vaccines right now in Trinidad and Tobago. Secondly, the major mistake this government has made is border control and the management of our borders and allowing the P1 variant to run amok in our population. That is a major contributing factor to what we are seeing right now and the mortality of many of the younger persons in our population. The Brazilian variant will prove very difficult for us as a society to combat. And thirdly, the third mistake was the Easter vacation, where Prime Minister Rowley asked everyone to drop everything and to go to Tobago. That was the third major mistake, and it has led us to this situation where we have an explosion of cases where persons, COVID positive, symptomatic or asymptomatic, may have commingled and gathered in Tobago, returned to Trinidad, and spread to all four corners. It is almost impossible now to come out of community spread without drastic health regulations. And we as a population have to undergo this. Minister, we are in a very, very precarious situation in Trinidad and Tobago. The opposition and my opposition leader stands ready to guide you and your government during this very difficult time. I thank you.
Thank you very much, Dr. Sitran. That was an excellent and very informative presentation. Many, many highlights, which I'm sure the media will have an opportunity to ask later. For me, I have to say that your information on the difference between the Pfizer third shot and the Sinopharm third shot is an extremely important distinction to make, and the case about testing. I now want to hand over to Dr. Rai Ragbir, the MP for Kumuto Manzanilla, who's also shadowing the Ministry of Health. Dr. Ragbir.
Thank you, Dr. Megu. First of all, good afternoon. Blessings to all the viewing audience. As you may see me, I have on my PPE as I came from my job. And my position here is not only to protect myself, but to protect everyone that is around me, and to ensure that wherever we are, that we practice good public health guidelines in everything we do. And I want to publicly thank the political leader, Kamala Prasad Bisesa, for her wisdom and fortitude for us being here today, so that we can impart some pertinent information to the citizens of Trinidad and Tobago, to this blessed country. And I dare say her love and concern is not only for UNC people, nor is it only for PNM people, it's for all of the citizens of Trinidad and Tobago. And during this COVID-19 pandemic, my brothers and sisters, I want to compliment our frontline healthcare workers for their hard work, their selfless service and resilience. Condolences to our fallen heroes, such as the practitioners, the police, and other persons during the line of duty who have passed on because of COVID. And condolences also to the families who have lost the battle, the loved ones. And it's a sad, sad time in the country and in the world. And we must remember our prayers and our thoughts and our love are with you all. And I'm certain that each one of us has been affected by someone who has been infected with the COVID-19 virus, or, as even in my instance, someone who died from COVID-19. Friends, it is home, it is here, it's all over the world. No one knows when this scenario of a global pandemic is going to finish. So I will preach this from now right down to the end. Don't become complacent and reckless. Obey the public health guidelines totally, always. These are difficult times, my friends, and it reminds us of our weaknesses and our inability to cope. We want answers, we want vaccines, we want beds, we want medications, we want a better economy. The PNM leadership has failed and continues to fail. They gave us what we needed? No. Our people are suffering. Some of them don't even know when the next meal is coming from. But we have God, we have prayer, and your prayer must be fervent and earnest and pray for all, because God answers prayers. We must never forget, friends, that this government flippant way of handling the COVID-19 pandemic started off in Parliament when the Speaker then said it was not a matter of public importance. It was raised in the Senate, and my colleague, Dr. Bodo, actually raised it with the CMO at that point in time. And because of the tardy response of the government and dragging of their feet, this is why we are in the position today. If the testing was done earlier, as my colleague had said, if the vaccines were procured in a timely fashion, we would not be in this position. We are humbled and thankful to all our public servants, especially now those in the Ministry of Health who have taken charge. Dr. Roshan Parashram, the CMO, Dr. Hines, and Dr. Mariam Abdul-Richards. They work tirelessly, 24/7. One can only imagine what goes through their minds and how they take care of their families, doing the service for Trinidad and Tobago. My friends, your good deeds will not go unnoticed. And saying what she, as the political leader, has said, she admires those who are at the helm. The COVID-19 pandemic triggered a mental health pandemic. You know, the recent Lancet medical journal said 1 in 5 persons who get COVID, within 90 days, they suffer from anxiety, depression, and insomnia. That post-traumatic stress disorder is very real. And it's so quaint that May month is actually Mental Health Awareness Month. And many of our people who now are home, they are fragile and vulnerable to depression, anxiety, and stress. And many people have suicidal thoughts who didn't have it before. And those who are being depressed, they have worsened scenarios of depression. So my friends, we need to look out for one another because of social isolation, loss of income, loneliness, fear of being ill, or dying from the virus. There's a term we use in medicine, agoraphobia or agoraphobia, which is a fear of leaving your house. And I'm sure 90% more of us in this country and the rest of the world have that issue, the fear of leaving your home. Due to this situation, we find ourselves in more and more troubles, but we need to find solutions. Talk to someone, pray with them, form online support groups, do some breathing exercise, yoga, or whatever you can do. So, having said all that, so let me start. You know, they always say you receive things in your mailbox. Well, I received something in my mailbox. And when I saw it, I was concerned. And then I read it again, I was more concerned. And it hurt my heart to find out whether this is valid or not. It titled, Doctors Under Attack. COVID-19 patient lives at risk at Couva Hospital. United National Congress calls for urgent investigation in 2 claims that senior doctors are being forced out of the Couva Hospital by the North Central Regional Health Authority management amid the deadly COVID-19 crisis. Now I am very concerned, as I said, for my colleagues and patients alike. We took the Hippocratic oath to do no harm and look after everyone. So I am calling on the health minister urgently and impartially investigate very disturbing claims that some of the most experienced and senior medical doctors at the forefront of the unseasoned COVID-19 battle at the Couva Medical Hospital have been forced out of their jobs for questioning allegedly bad and potentially dangerous management decisions of senior officials at the NCRHA. We have been informed by very reliable sources with the upper echelons of Ministry of Health that as of this week, senior doctors with the following medical specialties and posts have been transferred from Couva Hospital by the NCRHA's senior management. Chief of Staff, Head of ICU, Head of Nephrology, Head of Medicine, Infectious Disease Specialist, Nephrologist, Pulmonologist, Infectious Disease Specialist, and Chief of Staff. Again, I will compliment those senior members of the Ministry of Health for their work. The UNC has the names of these doctors and the specific details regarding their respective transfers. We are reliably informed that they are the key frontline medical practitioners who have designed, crafted, and implemented the life-saving medical protocols for the management of COVID-19 patients at the Couva Hospital, particularly for the ill patients at the high dependency unit, the HDU, and the intensive care units, ICU. However, we will not make their identities public for fear of them being subjected to vicious personal attacks and further victimization at the behest of the respective powers that be. We salute these brave, courageous, heroic doctors and all the dedicated, hard-working frontline medical practitioners who are risking their lives and that of their family daily for the sake of battling the deadly COVID-19 pandemic in Trinidad and Tobago. Our information is that amid the latest calamitous explosions of record-breaking COVID-19 cases among the Trinidad and Tobago population, where a record number of citizens have been dying at the nation's parallel healthcare institutions, including the Couva Hospital, these senior medical professionals had voiced serious concerns over the poor management decisions allegedly made by NCRHA management officials who have no medical expertise, training, or qualification whatsoever. Instead of heeding these qualified, dedicated frontline medical experts, however, the UNC was told that they were treated with vindictiveness, hubris, and spite by certain political appointees in the NCRHA management, and unceremoniously pressured and transferred out of the critical position. This has reportedly left the Couva Hospital dangerously adrift at this crucial time, where the Rowley-led government has been forced to call a state of emergency in its ongoing efforts to contain the deadly COVID-19 pandemic, which it has thus far failed to manage in any tangible manner. If the allegations are true, the NCRHA's management, and by extension the Ministry of Health, stands guilty of workplace bullying, violating the enshrined constitutional and labor rights of the doctors in question and other affected staff members, outright nepotism, and even criminal behavior, given the fact that any deliberate move to destabilize our already fragile, broken parallel health system at this time could cost citizens their lives in the unending, deadly COVID-19 crisis. The UNC knows that it's not the first time that the NCRHA's senior management has been embroiled in such serious allegations. Notably, the NCRHA CEO, Mr. Davlin Thomas, has appeared at the latest Ministry of Health news conference. Mr. Thomas is a political appointee to this critical post in the public health sector, and he also serves as the deputy chairman of the National Carnival Commission. Finally, the UNC expects Health Minister Terence Yalsing, along with Mr. Thomas, to shed some public light on these serious allegations, since citizens' lives are at stake. We also reiterate our call to the Rowley government to refrain from its dangerous nepotistic practice of appointing unqualified political figures to senior, important public sector jobs where they collect multiple large salaries at taxpayers' expense, since this is seriously compromising the effective running of the country's numerous public institutions to the detriment of the citizens. My friends, this is worrisome. And you want to think about worries? Let's look at what came out in the newspaper yesterday, Thursday, May 20th, 2021. This is today, and this is a Wednesday newspaper, where it was said in a media briefing, the parallel health sector, the system, is now 80%, 84% occupied. So as of Wednesday, all the HCU was 100% occupied. The ICU, 77% occupied. Cora Hospital, 89% occupied. Couva Hospital, 75% occupied. Augustus Long Hospital, 95% occupied. Arima Hospital, 93% occupied. St. Anne's Hospital, 100% occupied. Even the step-down facilities, Point Fortin Hospital, 75%. UTT Valsain, 52%. And Debe Campus, 86%. So according to the Principal Medical Officer of institution, Dr. Marian Abdul Richards, she said basically, quote, in simple terms, our hospitals are filled. I understand the ambulance service is also compromised because there are two types of the ambulance service that's running. We have a lot of people on home quarantine And when they get more sick, the ambulance has to come and pick them up and take them to the hospitals. So you can imagine those people who get heart attack and stroke. It's a nightmare what's happening. So the question is, my friends, are we being told the truth? Right now, I understand the positivity rate is about 40% and maybe more. That means every 100 patients who COVID test with suspect symptoms, 40 out of the 100 have the positive test. So more and more persons are in home quarantine. I will tell you, my friends, partially, and self-isolation partially. And why do I say that? Presently, you can see it throughout the country. People who have a positive COVID test, who have mild symptoms, so they are at home. And just to reiterate, 1 in 3 persons who have COVID, one of that persons have absolutely no symptoms. They are asymptomatic, as my colleague Adosa Chicharan said, even when in the situation with Tobago. Now, so that's 1 in 3 persons who are asymptomatic. So you don't know. If you go in the supermarket, you go in the market or anywhere else, you don't know if they have COVID, but they don't know either. However, 80% of patients who have COVID, mild symptoms and is self-limiting, they will recover. However, 15% moderate symptoms and 5% is where they end up in ICU. So as I said, partial isolation. So that what means they go into the grocery and they have COVID. They're going to take a drive. Nobody will know this is Trinidad and Tobago. They go in by the veggie store to buy veggies and they say they're going quick and come back. So who is monitoring all of this? My friends, we're in trouble. I have patients right now who are very ill and they're COVID positive and they're trying to get an ambulance. And I challenge you, the system, I will tell you, from what was said yesterday to today, and more cases every day, the system has collapsed. It's not a panic because we ourselves are to blame as well. You see the supermarkets, exactly what I said, everybody going every day to buy something in the supermarket. This is not a government issue alone. This is all of our issue. This is lives of ourselves and family. Dr. Sricharan spoke about the P1 variant. As we have seen recently in China and India, right? They have variants in other countries, UK, South Africa, but China had a double mutation and that was more aggressive and the mortality was higher and more infectious. Now we are seeing in Singapore, they have another variant, and this variant is affecting the younger children. Now, remember our young children, they don't get the vaccines. Well, not as yet anyway. Secondly, the immune system is not developed. And thirdly, those children tend to have more face-to-face exposure. So the question, where are we going from here? Fortunately, on the 7th of May 2021, the World Health Organization approved the Sinopharm vaccine. The other vaccine that's emanating from China will be the Sinovac. But the Sinopharm has been approved. And they validated the safety, efficacy, and the quality. And I tell people out there, if you are qualified to get your vaccine, go and take your vaccine. It's the first vaccine of its kind from that end of the world, the eastern part of the world. Now, the Sinopharm jab is 2 shots, and it's taken 3 to 4 weeks apart. It's given in the arm, and this Sinopharm vaccine is the Beijing variant here. So far to date, there have been 65 million doses administered to people all over the world in 45 countries. So let's look at this, for instance. To date, there has been over 1.5 billion people in the planet who has received vaccines. So while we look at one side of the world, on the west, we have America and Canada, then we have the UK and Europe. The first world countries, the people are getting the vaccines. There are many people with conspiracy theories. Do not, everything you read, everything someone tells you, don't believe everything, because let me tell you, my friend, you could get the COVID, you could die. Right now, I'm monitoring 15 homes, people with COVID infections who are in home quarantine. And the thing is, do not play with this. And to mention that, what is happening in this country and other parts of the world, more and more persons will be under home quarantine. they are positive for COVID, they have to remain home quarantine. And there is a difference, my friend, between isolation and home quarantine. The word isolation means you have to isolate yourself from your family in terms of the washrooms, into the kitchen, in terms of your bedroom. But and you have to wear masks all the time, all the way in your house. So there are three major signs that your COVID-19 is turning dangerous. The severity is noticed by day 5. Bear in mind the coronavirus is just like any respiratory tract infections. And we are inundated with Sahara dust. So people will have symptoms of allergies and whatnot, and they think maybe regular allergies, and they may not know it is that. So they may have a fever, which may actually persist beyond 4 or 5 days. The second thing is that they may have a dry, hacking cough. And thirdly, they may have chest congestion. But what is important here to look at, we must have solutions. And the solutions are where we're going from here. The healthcare system is actually overwhelmed. I would say now, and I tell the ministers, let's look at Arthur Bolden Stadium. Let's look at Brian Lara Stadium. We in Point-a-Pier here, Manny Ramjohn Stadium. Let's look at Larry Gomes Stadium. We now have to use our doctors, our nurses, the junior ones, and those in training, vaccinate them, train them, and use it. Use them in these facilities. And why we can't think of actually, as I end, getting a cruise ship with 4,000 beds and use it as exactly was done many years ago during the Chogam. Ladies and gentlemen, as I close, we need to do things differently. Thank you.
Thank you very much for that very informative, equally informative presentation, and the worrying developments at the Couva Hospital. Very serious. At this point, we would like to open up the platform. We have some reporters here on Zoom, and we have some people who have also sent in questions via WhatsApp. Let us start. Do we have anybody who has any questions at the moment? Let's see. Okay, I don't see anybody on the Zoom. I see. Sorry, Alicia Boucher, did you have a question? Okay, I will unmute you.
Yes.
Good. Yes. We have Ms. Alicia Boucher.
Yes. Hi, Alicia Boucher from CD6 here.
Sorry, we're not hearing you. I think.
You're not hearing me?
Please, can we see her?
Are you hearing me?
Yes.
Okay. Hi. Good afternoon to everyone. Dr. Sicharan, you spoke about. You mentioned that the UNC did not flip-flop on vaccines. You simply wanted the best, and you cited the mRNA vaccines, which are Pfizer and Moderna. You said that we are the richest CARICOM country and we deserve better. But in terms of the larger countries, and we've heard what the issues with these vaccines are in terms of the larger countries buying up the stocks and basically securing it for their population, then what are we to do in a situation like that where smaller countries basically, even those in the Caribbean that have received vaccines, they have not received stocks of the Pfizer vaccine?
Thank you for that very good question, Alicia. So if you were to look into the international media of last week, the CEO of Pfizer said that he contacted every single country, every single low-income and every single middle-income country in 2020, asking them to make an order of Pfizer vaccines so that they could put in their order should the vaccine get WHO approval, it would be shipped directly to the country. And he said that he went to lengths to do this, where he actually texted prime ministers, where he actually called prime ministers, and he had his agents constantly asking governments, every single low-income government and every single middle-income government around the world to make their order of Pfizer vaccines because supplies were limited. And what this means is that Did he contact Trinidad and Tobago, and why did we not take up this offer? Because this is exactly what we did with Sinopharm, right? Sinopharm was not WHO approved when we started to engage in talks with them to acquire vaccines, and a large number of vaccines for this country. And we waited until Sinopharm got their WHO approval, and then we finalized the agreement where vaccines would be shipped to Piarco. And this is something that we could have done since 2020, October 2020. We allocated funds in the budget to purchase vaccines. The Minister of Health at the time said he was in talks with Pfizer. So what went wrong? Pfizer is the premier, in my opinion, the premier vaccine in the world for COVID-19. The European Union has made an order for 1 billion doses, and they are trying to give away their AstraZeneca vaccines, as well as the United States. I'm not trying to disparage the AstraZeneca vaccine. I myself have a first dose of the AstraZeneca vaccine. But my point is, Pfizer is a very, very good vaccine, as well as it has been authorized for children between the ages of 12 to 17 years of age. We would have been able to vaccinate our secondary school children and allow them to return to school safely in September of this year, as well as that is a huge chunk of our population and would enable a larger proportion of our population to be vaccinated, and thus for our country to achieve herd immunity. The Pfizer CEO also went on to say that 40% of all Pfizer vaccines that are being distributed in 2021 are going to low and middle income countries. Now, other CARICOM nations may not have had access to Pfizer, but if you compare us to countries that are in our similar GDP category around the world, you will see that we are bottom of the list.
Any follow-up question? Okay, sorry, I thought you had a follow-up question. We have some questions sent in as well from Ralph Banwari. I will read them to our presenters. One, what do you believe has accounted for the high number of COVID cases in your area? I believe that is probably, yes, for Karen.
I myself, I have spoken to many COVID-19 positive persons in Caranese, because what we do is once the family is quarantined, we drop off food for them at a distance on a table, and we allow them to then collect the food after. So we give them food assistance. They all say exactly what the Prime Minister of this country has said. They have no idea how they got the virus. They were doing everything correct, and I believe them. What I can say though is that many persons in Caroni East, they live in multi-generational homes. So you have the grandparents, you have the parents, as well as you have the children. So it's a huge household, right? So in a house you may have upwards of 10 plus persons, and should one person get the coronavirus, everyone, all 10 of them will have the coronavirus and be quarantined. So that person may have gotten it, maybe in a different part of Trinidad and Tobago, and come home at night, and then the entire household has gotten coronavirus. And the Ministry of Health really has to do more research into why persons may, why is there such a high prevalence in certain areas such as Caroni. I saw Sandy Grande has a high prevalence as well, up in the west as well. But these are high density areas in terms of population, and the households are very, have a lot of persons in each household. So should one person get it, the entire household will get it. And I think that would contribute to our very, very high numbers.
Okay. There was another question sent in, again from Guardian Media, which is, what are you doing to educate the constituency to help curb the numbers? Okay. Education.
More has to be done. I myself, I have always been an advocate for vaccination, and I do whatever I can to tell persons they should be vaccinated, they have to be vaccinated. But that is really an issue for the Ministry of Health, and they need to do more. And I have always said this, what their approach is, you have Minister Dialsing sitting down with the doctors and having a scientific meeting. And that is basically what it is. When Dr. Avery Hines talks about the different axes of his graph, I am sure 90% of the viewing public don't understand what's going on. It's very complex. And more has to be done in terms of, I would say, television ads and public health education, not only on television, but on print media, as well as on the radio. As early as last year, I was making a call for some of our Calypsonians to create jingles, a national song, to tell persons go out and get vaccinated. Many of these entertainers did not have any income during the carnival season, and the ministry or the government should have awarded persons contracts to create little jingles, even little extempo songs. And you have that playing on the radio all the time. That would go a long way. I've seen cases in European countries where when you get a vaccine, they give you a donut. Other countries, when you get a vaccine, you would actually get another incentive. And as I said before, in New York State, they're actually giving you a lottery ticket, giving you a chance to win a $5 million US lottery, first prize, if you put yourself to get vaccinated. So more needs to be done. The public health education by the Ministry of Health has to be brought down to a lower level where persons could easily understand the message that they are trying to send. It's a little too complex right now, and the Minister of Health should allow the health professionals to do their job. Just allow them to do their job, and he should do his job.
I think Dr. Rai?
Yeah, actually from the early onset, as a practitioner in my constituency of Kumoto Mansinala, we had actually started cottage meetings where we would educate the population then, the communities, because there are so many rural communities, about the pros and cons of taking the vaccine. And they were always asked, the first thing is not the advantage, the disadvantage in terms of what it will do them and whatnot. So they have to be sold. And as Doc had said that the Ministry of Health, they have a health promotion unit. They need to use the unit to actually empower people to take the vaccine. And actually today in the newspaper, there's a fantastic article, Communication Strategies Advice, Government to Improve Vaccination Programs. This is by several people where they suggest creating a social platform and using the internet to actually sell the vaccine in terms of its importance and where Trinidad and Tobago should be. So I think at the end of the day, to remove all those conspiracy theories and all the myths, throw them out and actually talk to people on a one-to-one. And we can use the social media.
Okay, thank you. We have another question. Okay, Alicia Boucher again. Okay, we're not hearing you as yet. Do we have her? Try again, please. Alicia? No, we're not hearing her.
No?
Yes, we can hear you now.
Okay, great. Dr. Sicharan, you raised the issue of border control a while ago in relation to the P1 strain. But we've seen where, police officers, they have detained Venezuelan nationals who have been caught entering our borders illegally. They go to the courts, they're fined $2,000 and then released back onto the streets. So while you have a level of detection where police officers are actually getting the intelligence to be able to go to these places and detain these persons, when they go to the courts, then they're just allowed to go back onto the street with a $2,000 fine, and we would have heard the police commissioner express some frustration over that. What is your position?
That has to be addressed, and I think we have over 700 police officers that are currently in quarantine. We have, I think, over 100 officers that are currently COVID-19 positive, and we have lost, I think, at least 3 officers thus far. May they rest in peace. So police officers are frontline workers, and more has to be done on the seas and on land to stop the illegal immigration of migrants. Venezuela is awash with COVID-19 cases. The first case in Venezuela was in March of 2021, and Nicolas Maduro said he said that on state media. And because the P1 variant is so contagious, it basically takes over the original coronavirus. So at the longer it's there, there's less of the original coronavirus strain and more of the more aggressive Brazilian P1 variant. And we knew from December of 2020, I wrote a statement, and it was published in the Express, where I said during the issue of the no confidence motion against the Minister of National Security, that one of the biggest issues we had with national security was actually medical illnesses coming across from the South American mainland because of deficiencies in our national security. And it's not only COVID-19, it's measles, it's malaria, it's diphtheria, it's all these different things. The entire medical infrastructure of Venezuela is completely broken down. Most of the doctors, 90% of the doctors in Venezuela have migrated, and there are little to no medications in Venezuela. So these persons have no choice. They basically have no choice. Their only hope is to get to Trinidad in order to save themselves and their families. And many of these persons in the process of getting here may contract coronavirus, the P1 variant. And when they're here, they go directly into their communities. We have the Venezuelan communities throughout Trinidad and Tobago, and they mix with them. And for example, in Caroni, we have quite a large number of Venezuelans renting in Caroni. So that could also account possibly for some of our high cases. I'm not trying to blame them, but that definitely would be a contributing factor. More has to be done to protect our police officers when they interact with these persons, as well as our Coast Guard personnel. They need better PPE, and they need proper protocols on how to engage these persons on the sea and on land, and what has to be done, and they need the protective equipment to interact with these persons. And then we are putting these persons into a police cell, into one of our police stations, where they could, if they are infected, contaminate the entire police station as well as the cell, and you have other prisoners going into there. So it's a very, very complex situation, and more has to be done. Not enough is being done. Even if we were to get this current surge somehow under control with these restrictive and draconian public healthcare measures, we still have the possibility of more coronavirus coming in through Venezuelan migrants.
All right, thank you. The press conference has gone on past our time. We thank the media for attending. There was one question about the Couva Hospital from Anna Ramdas at the Express, whether the opposition will be taking any action to obtain answers, and we certainly are looking into all options at this moment. So I want to thank you very much. Thank you for attending on Zoom, for sending in your questions on WhatsApp, for looking at us on YouTube, on Facebook, and beyond. Again, stay safe. Take care, and thank you again.